Hey everyone, how's it going? It is Tuesday, June 24th, and I thought I would come on here today to provide a little bit of an update, as well as talk about wound care, because that's like big in my life right now. So today is actually 6 weeks and one day since my double mastectomy with deep flap reconstruction. And today is probably, you guys, the best day that I've had. I slept really good. I feel really rested. I just have a little bit more stretch in my body. I'm kind of almost 100% upright, and I just feel good. I was able to kind of get up this morning, clean up my room, and, you know, do normal things. Like I got to water my garden for the first time, which was really amazing because my garden is my happy place. Got to do that, got to clean up the kitchen a little bit. Cleaning is very cathartic for me. So it just felt really good. It felt really normal. I was able to take a shower and wash my hair and just everything feels pretty good. I was able to do my in-home PT exercises and keep my arms going. And I don't know, it just felt really, really nice. And so I've kind of been waiting to have a day like this where like it feels like progress, right? Like I've had a lot of stops and starts along this journey. And, truthfully, I have felt better than I thought that I would along the way. So that's been great. But as of recently, with some of my wound issues, it's just felt really difficult, right? Like I felt like I was doing pretty good, and then like we'd have a setback, and then like get that back on track. And then all of a sudden there was another setback. And then this last week, um, you might know from my other video that I had my 6 week appointment last Friday, and I was like feeling really wonderful because I got released of all restrictions. He took the stitches out of my stomach. He gave me permission to start PT. He said that I could drive when I feel comfortable, that I could start to really try and lay flat and get a little bit more stretch, and all the magical things that I have been waiting to hear. And then Saturday morning, I woke up and the one of the two spots where he took the stitches out of my abdomen really opened up again. And so I was really freaked out and really fucking defeated. And now we had to have the nurse back in on Saturday. And then now I'm on another level of wound protocol for that area because it's an actual hole and open. So it fucking sucked, right? It just did. Like Saturday, I was really depressed about it and kind of didn't walk much because I was like, I didn't want to disrupt it anymore and have it get even more open. So that was really frustrating. And then Sunday, I didn't feel really great. So that was kind of weird. And I don't know if that was because I was in my head about this thing opening up and like worried about infection and like more things going wrong and la 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 la. So it just took me a while. And then yesterday was a little bit better. I had the nurse back in again. She reviewed it, kind of looked at it. We did another measurement. Everything is good. It's starting to heal and do what it needs to do, but uh, it was just a lot. So I napped a lot yesterday and just kind of took it easy. And I don't know, today I woke up and I just feel good. I feel normal-ish as much as I can since I've had this surgery. And so I'm just super grateful for that. I feel like I've been waiting for this moment. So I needed to give it some space and just honor that and say, yay. So that's really good. So there's that update. And then the second thing I wanted to talk about, excuse me, is really wound care, right? So since I had my prophylactic bilateral double mastectomy with deep flap reconstruction, I have been on wound care. So when I had my surgery, and I've talked about this in previous videos, my breasts blistered. So you get these kind of big blood blisters, if you will. It is a side effect that's known to happen with mastectomies. It's particularly known to happen with quote unquote virgin skin like mine. I haven't had cancer, I haven't had chemo or radiation. The skin hasn't really been touched in any way. So it's really kind of like a trauma response. Um, and I'm just one of the lucky ones because I'm a delicate flower that happened to. So I've had to be caring for my breasts and all my incisions and everything since my surgery, but it's been a lot, right? So what does that look like? So since I came home from the hospital, and even while I was in the hospital, they were having to treat with this cream called Silverdene, and basically you wash the breasts off and make sure that they're clean and dry, and then you have to put the Silverdene on all the areas that are bruised or blistered, or where the skin may be sort of necrotic, if you will. Cover them up with the cream, then put these patches over them, and let that stay. And then you have to do that twice a day. So that in and of itself is kind of a lot. And in the early days of my surgery, or the early days after my surgery, it was really difficult for me to do, not only because it's a lot to do to try to do that, but because I didn't really have mobility of my arms, couldn't really feel my chest. It was really hard for me to even look at it, to be honest. Like it looked really horrific. Like my chest got beat up, like black and blue and purple and yellow and just black in some areas, like really difficult. Um, so that was really tough, to try to manage that. And so fortunately, my husband was really good about like being able to help and partake in that and really do some of that for me, right? We were kind of partnering in the beginning until I was able to take that over and do that myself. So fast forward to where I'm about 3.5 weeks out post-op, and I started having these other wound issues, right? All of a sudden I went from doing well and kind of healing pretty good to then having all of these like little wound issues pop up. And again, I've talked about this in other videos, but I had a couple of pinholes open up. I had kind of a larger incision under my right breast open up. And then I had the lower area of my abdominal incision open up in the two spots. My hip drain came out, but I was still leaking from that. My belly button was doing pretty good, except for then the first day I got into compression garments, I ruptured my belly button and that started to bleed, and then I had to treat that. So kind of to show you, not pictures of me, but to kind of represent what I'm dealing with. So if you see on here all of the red areas that are outlined, right? These are all the areas that I'm treating. So on my right breast, this whole area in the center of my breast, including my nipples, I've had to be treating with the Silverdene and be washing that twice a day. And then these three incision lines underneath are where I had breakthrough spots in my incisions that opened up. These two pinholes are other areas where my incision opened up along with this along the left breast. And then with the left breast, the same center area, much like the right, where I had all the blistering and treating. This would be my hip drain spot. So the reason why there's a line here is because I had two spots. So the one hole you see is where my actual JPJ drain came out, and I was leaking from that. Well, subsequently, close to that was another small, not incision line, but area where I had this like pinhole opening along this incision line, but I was leaking from two spots there, and we don't know like why I was leaking from there essentially, but that closed up pretty quickly. But I still had to treat that, right? My belly button. So because my belly button, the hole was, when they pulled me down and stretched me, they had to cut a new hole for my belly button. So that's all like new tissue that's forming. So my whole belly button is actually healing right now. And when I ruptured it in two spots along the outside edge, on either side. And so I've been having to treat that and keep that clean. And then along the bottom here, you see this little line down here. So that was one area where it opened up and along my abdominal incision. That one was pretty small in the sense of like it didn't open up really far, but it was a little long, probably about an inch. And then this other side was about a 2 inch gap or a 2 inch opening, opening. But then it also opened wide, which is why it's kind of a block because it's on either side of the incision. So that can kind of give you an idea of like all the spots that I'm dealing with. And now I had a few other pinholes. I had a pinhole under here. I had a pinhole up here. And I had one more on the right side of my lower incision. But all of those little tiny holes closed pretty quickly once we started treating them. But this right now is kind of a daily thing. And a lot of women go through this, right? Like some women are really fortunate to heal pretty quickly and have no issues. And I'm jealous of them, to be really honest. But for me, being immunocompromised, with scleroderma and Lyme, I kind of knew that I was a slow healer anyway. It's really part of why I focus so much on getting ready for this surgery, working on 100 grams of protein a day, working on 20 to 40 milligrams of collagen a day, making sure I'm getting 120 ounces or more of water a day, because all of these things fuel your body in a way to heal all of this. Because as you can imagine, like, your body is going through a lot, right? It needs to be fed in order to heal. And so that was really important for me to make sure that I was doing that. Additionally, making sure that from a vitamin and mineral perspective, that I really optimized my nutrition in that way to know that if there were areas where I was deficient, that I could take supplements to support that. So I take zinc, magnesium, B, D, C, and E. So again, super important to make sure that I'm giving my body what it needs so that it can regenerate and support me in getting healthy again. So, what does wound care look like? So, with all of those spots, I have to do this sort of washing protocol, if you will. So, every morning when I get up, I have to take off all of the bandages before I get in the shower. I need to kind of wipe everything down because I've had the Silverdene either on my breasts and or I've had the Aquaphor or yeah, right now just the Aquaphor on my belly. So need to like remove all the bandages, wipe everything down before I get in the shower. So then once I get in the shower, I have to use an antibacterial soap. They really kind of want you to stay as sterile as possible. So I get in the shower, I use antibacterial soap, I wash up and soap all the spots, and then I leave it on there while I wash my hair, wash my face, if I'm going to shave my legs, whatever. Do that. Then once you rinse everything off, then you rinse off the antibacterial soap. Usually, what I'll do is I'll go through, I'll have a washcloth in the shower. I wipe that down again to make sure that there is no sort of cross contamination, right? It's really important for you to make sure that you're not getting any other junk in those areas or those wounds while you're cleaning up, right? Now, I will be honest, like I'm sure a lot of people aren't as probably hyper vigilant about it as I am. But again, being immunocompromised, getting these wound issues, being a slow healer, I want to do everything I can to make sure that I'm really taking care of these wounds in a way that they will heal, as quickly and as well as they can, knowing that I'm already delayed, right? So once I get out of the shower, so I sort of then rinse everything off as I can in the shower. I have a handheld, shower head, so I make sure I go over and rinse everything really, really well. Then I take the same washcloth that I was in the shower with, and when I get out, I go to the sink. I rinse it out really good with warm water, and then we do sort of another sterile pat down. Make sure that we've removed all soap and everything. You kind of take a look and review everything. And then once that's done, I literally dry off the rest of my body with a hand towel, not touching my incision areas or my breasts at all. And then I take a hair dryer and I dry those spots with my hair dryer on cool, on low, until they are pretty dry, right? The reason I do this is because when you're dealing with these wounds, you don't want to, when you're putting new medication on, you don't want your wounds to be wet or damp. in any way. So I have found that rather than going through a bunch of towels, because also towels can leave lint, you don't want to cross contaminate with the towels. So I found that a blow dryer just works really well. So I'll stand there, I'll blow dry my body, blow dry my breasts, under my breasts, my belly button, the incision line across my stomach, and that open wound, which, by the way, feels really fucking weird to be using a blow dryer to blow into your stomach, because even though the wound is open, and fun fact, I'm still partially numb there, but I am getting sparking. But when you blow air into it, you can feel it coming around the sides, and it's just the most bizarre sensation. But a lot of things about this surgery have been really bizarre. So once I'm really good and dry, then I put the hair dryer down. I take out my tape because I have to tape all these spots or tape the bandages on all these spots. I use my towel rack to measure out all the pieces of tape that I need. I get those all set up so that I don't have to reach for those or try to do that once I get gloves on, so that I'm staying as sterile as possible. I line up all of my bandages that I need on my counter, and I put everything in there once before I get in the shower. So I know I need, 3 bandages per breast, and I know that I need, the soft gauze underneath my right breast, and another piece for my left breast. I know that I need these long Q-tip things to clean out my belly button and to, excuse me, use to put the Silverdene on. I need gloves, etc. So I get all that lined up on my sink and put that off to the side. So once I'm dry, the tape is set up, all the supplies are there. Then I use hand sanitizer to make sure that my hands are all nice and clean. And then I put on fresh gloves. Once I start with the gloves, the first thing I do is I get all of the lotion and the Silverdene on my breasts. I use the Q-tips, the big long Q-tips that they give you that are sterile. Everything is in sterile packaging. So everything you're pulling out is sterile. You're not cross-contaminating in any way. I put that on my breasts, get those done. And then once I'm done with those, take off the gloves, new gloves, put the bandages on. Then I tape everything up, make sure that those are all good to go. Good there, swap out the gloves. Literally, the reason why I do this is because you are touching different areas, and you're touching, sometimes some of the lotion gets on your gloves. And again, when you're opening new packaging and putting on these, gauze in these different areas and these nonstick pads, you don't want there to be any cross contamination, because you don't want to further any infection or introduce infection. So I spend a lot in gloves right now. So once the breasts are done, then I work on doing the incision line under the breasts, which doesn't get any medication, but it does get a specific non-woven gauze pad. So I get that taped into place on the right breast, or sorry, yeah, on the left breast. Then I go ahead and get the top spots done where there's still those little pinholes and openings, tape those up, and then I move on to the abdomen. So with the abdomen, where my JP drain was taken out of my abdominal incision, I still have leaking. That drain was taken out 3 weeks ago. It's normal for it to have some leakage. I kind of have a lot still going on. So there's been some question, should we have left the drain in? Should we have taken it out? Like, it's mixed. My surgeon felt like it was fine for it to come out. I think we're both a little surprised that it's still leaking as much as it does, but it's better that the fluid come out versus staying in the body. When it stays in the body, then you're at risk of a seroma, and then they have to go in and drain that manually. That's a bitch. Don't want to go through that. Or you're also at risk for sepsis, which is something you have to be really mindful of. So, which we've been cautious of, but fortunately for me, that's all been draining out. So I have to just change the bandage here a couple times a day, make sure that that's all good. And it has been, and we haven't had any issues. So then next I treat my belly button. And so treating my belly button means taking more of those sterile long Q-tips, poking that in your belly button. I use a mirror so that I can see what's going on, and clean out the belly button and make sure that it's really dry, because you are healing from the inside and then along the outside as well, where I had both the 2 ruptures on either side, and then just scabbing from the surgery itself where they had cut the skin. So that's really interesting. So I get that all cleaned out with with the Q-tip, and then I'll take a little bit of Aquaphor and put that around the outside, a little bit on the inside. You don't want it to be like really goopy. You just want enough to kind of like cover it so that it doesn't get dry, so that it doesn't itch, the skin doesn't crack, all of those things. Aquaphor is like magic. I can't even tell you how well it's helped everything heal. So that's the belly button, and then we sometimes I'll put just a Band-Aid over that, but generally I use an abdominal pad over the whole lower region. Then the rest of my incision is pretty good. No, cracks or holes or anything along the incision line. But the two spots where I had stitches, then I have to treat those areas. So again, change the gloves, put on new gloves, sanitize up. And then I have to take Aquaphor and put that on the larger open incision, which is really disgusting. There's a lot of things I can do, guys, and I'm fine with seeing stuff on other people, but when you treat yourself and it's your own open wound, it's a little heebie-jeebie for me. But I have to do it every day, twice a day. So here we are. So a little bit of Aquaphor around that area over that incision, and then I use a different finger to treat the other area. Again, a little Aquaphor, put it on that second spot that was stitched, and then make sure that that's good and moist, but not overly moist. Again, with these wounds, you want them to have enough so that they don't dry out, but you don't necessarily want them goopy. So once that's done, change the gloves again, and then new gloves, and then we open the abdominal pad and we get that on, and then we cover both the belly button and that abdominal area where the incision is. Now they line up pretty good right in the middle there, and then we tape those off. And then once that's all taped, then I can take the gloves off, and get dressed, put my underwear on, put my pants on, and we're good to go. But I have to do that a couple times a day. So usually I do that in the morning when I get out of the shower, and then I do that whole ritual again before I go to bed. And both times it takes me about 25 to 30 minutes to probably get through all of the washing, the dressing, the changing of the bandages, etc. Now, the caveat to that is that during the day, I do have to, usually 2 to 3 hours after I do the original dressing, I have to check the belly incision to make sure that if it's draining, that I change that pad. You don't want that incision opening to be sitting in kind of gunk all day. You want to change it out so that it's got a clean abdominal pad, and so that as it's draining, right, it's going onto a sterile environment and not able to fester in kind of any of its own juices and like create any sort of infection. But that's pretty quick. That takes me maybe 5 or 10 minutes. Take a look at it. If it's really kind of draining and messy, or if it's gotten like a little bit weird, then I will use yet another clean washcloth, do a little soap and water and kind of wipe it down. But otherwise, I'll just generally, if it looks like it's pretty okay, then I'll just change the pad, and then that's fine, and then wash it in the evening. But so that's wound care, right? So it can be a lot, an overwhelming part of this surgery. It's also really hard, as I said, to look at your body as you're already sort of cut hip to hip. You've got these, incision lines under your breast that don't look great. And then whether or not you are nipple sparing or lost your nipples, right? Then you could have additional incisions. And with me with the blistering, it's really hard to look at my breast. Like I was really excited to do skin sparing, nipple sparing, because I didn't know that I was going to get to keep my nipples. And I was really excited about that. And now my nipples don't look great. And it's really hard, right? Like to feel like you've gone through all of this and then you're like, fuck, like this doesn't look great. How is this gonna come out in the end? And in the meantime, you're like having to do this every day, twice a day, and that's a lot, and you're tired and all of these things. But ultimately, I think for me, it's come down to really one big thing and one little thing. The one big thing is I don't have fucking cancer, right? Like as hard as this is and as difficult as it is, and I want to have nice breasts again and, have my skin be healed and all of these things and not think about, having to have another surgery. I don't have fucking cancer, right? Like I did all this for the right reasons. I knew that it was the right choice for me. And I can feel really, really good in that and really happy about that. So, yay. Um, and then the second thing is, I just feel like in this journey, like it's all going to come out fine in the end. Like I'm going to get to a place where I'm happy with how this looks. I really trust my plastic surgeon. And I think that's the other thing is that I really think you have to trust your team because I think it would be different if I didn't think that my surgeon was talented. I would be more concerned if, you know, I didn't have that faith and trust in who is going to be making these changes on my body. And I really, really do. So I think that's really helped me kind of process all of this and kind of what I have to do every day. And the other thing I think that makes a difference is that anytime I freak out, which there's the moments during this journey where I have really freaked out, broken down, crying, like it's hard, right? Um, I've called him and said, called my plastic surgeon or texted him and said, I'm freaking out about this. Like, what's going on? Like, I need some answers. Like, and he's been able to kind of talk me off the ledge, right? Super responsive and great. I also have a really, really wonderful group of women through two of my support groups that I can reach out to and talk to. And, both women who were in the month of May, who all had their surgery. So we're all about the same time in terms of, our healing process and where we are. And then the other group is kind of women from all over who have had their surgery anywhere from, yesterday to, 5 years ago, 10 years ago, who can lend their experience to me and kind of talk me off the ledge again. And that's been so invaluable or so valuable to me going through this process and really both validating what I'm experiencing and how I feel, but also saying, oh, hey, I've been there. So, this is what I did and, try this or call your plastic surgeon and ask for this. And that's really made, I mean, just such a huge difference. I can't even really articulate it. So, I'm really grateful for that. There's that word again, grateful. I'm internally grateful. Um, so anyway, I just wanted to kind of come on and talk about that because wound care is a big issue. And even if you're not autoimmune compromised, you could be a totally normal, healthy person and go through the surgery and experience wound issues, right? So, and I'm not saying to expect that in any way, but it is part of this process and it is a lot to go through and deal with. But again, I'm just kind of getting through it and every day it gets a little better. And hopefully now, knock on wood, we're on the upswing of this. And we'll see where I'm at in 2 weeks when I go back for my next checkup. Unless something happens in the meantime, and then I still have nursing coming in for wound care every couple of days. So my next appointment is, I think, tomorrow, actually. So it's great, it's good to have that, eyes on when I can't get to the office. And also I can call them anytime and say, I'm freaking out. Like, this is what I need. Can I have a nurse today? And they'll come out and check me out. But um, anyway, I just thought it was really important to talk about what wound care looks like, at least what wound care has been like for me on my journey, right? I really just kind of want to be authentic and transparent as I can be around what this has been like for me, because this is a hard part of the process. And this is 6 weeks. I'm 6 weeks and a day into wound care. And, it's a lot. It's a lot. It's a big part of this. But we're getting through. So that's all I have for today. If you have any questions or concerns concerns, I don't know why you'd be concerned, but if you have any questions or comments, feel free to drop them below and I'll get back to you as soon as I can. Otherwise, thanks for following along and please share this video so we can spread the word for other women. Thanks.